The Northern Mindanao Medical Center proudly features one of its best practices and services in healthcare for the people of Northern Mindanao. Opening its doors to the improvement of stroke care services, Northern Mindanao Medical Center boasts of its emergency room as being stroke ready. We are one of the first institutions in the Philippines to offer IV thrombolysis using recombinant tissue plasminogen activator or RTPA. When a patient with acute ischemic stroke presents with neurologic symptoms, within the first 4.5 hours, the brain attack team of the hospital is activated. NMMC ER personnel can do a quick examination of the patient using the FAST approach. This is to determine if a patient is having a stroke. Once this quick assessment is done, an NIHSS score can be done by trained health personnel to determine the severity of the patient's stroke. The patient is then wheeled to the radiology department for a STAT plain cranial CT scan. This will determine whether the patient has a bleed or an infarction. If the patient's CT scan findings are suggestive of an hyperacute infarction, he is then reassessed and prepped for IV thrombolysis using RTPA. If the patient passes the screening for thrombolysis, the neurology consultant then gives the go signal to proceed with RTPA treatment, which is an important clot-dissolving medication given through an intravenous infusion. The patient is then transported and admitted to our neurocritical care unit, where world-class critical care and neurology care trained nurses take over in the monitoring and care of our acute ischemic stroke patients after they are given RTPA. Headed by our world-class neurologists and competent stroke nurses, patients who are given RTPA are admitted in this unit for close monitoring. On recovery, patients are instructed to have regular follow-ups at our IM outpatient clinic and neurology clinics. Here in Northern Mindanao Medical Center, we provide the best stroke care services in the region and improve health outcomes and help facilitate the recovery and reintegration of the post-stroke patient in our community.